Hi guys, how are you? I hope you're doing fine. I'm doing fine, kept of the Lord. Today we're going to talk about HIV and AIDS. In the previous series of the videos, I have been talking about the top communicable killer diseases in Africa. And today, HIV AIDS, if you can remember, is the second killer disease in Africa. That is sad. But the thing is, HIV should not be that killer disease. What is finishing people is the stigmatization, people not being willing to go out and have their status checked. And as a result, it is too late at times. So what is HIV? HIV in full stands for Human Immunodeficiency Virus. It is a virus, and what it does, once you are affected by the virus called HIV, it affects cells in the body that protects your body from diseases, and so you become weak. They refer to it as something which causes immunosuppression. So what are the different ways in which you can be exposed to HIV and AIDS? Number one is by sexual intercourse. And one thing you must know is that there are various ways through which people participate in sex. And the two most common ways is either sexual intercourse vaginally. I know most of us know that, but we also have sexual intercourse anal, through the anal. The second way in which you can be exposed to the virus is through blood products, contamination with infected blood. And this can happen in cases where people are sharing needles. For people who use drugs, intravenous drug users, they can share that, and unfortunately one of them is infected, the other person gets the infection. A third way in which you can be exposed to blood products is through blood transfusion. But thanks be to God, with the development of technology, nowadays your blood is screened for HIV, is screened for other infections, and that has become very rare. A third way in which you can be exposed to the virus is what we call vertical transmission from an infected mother to a child. That is why it is very important for you to know your HIV status. It will be so sad you get pregnant, you get a baby, all that while you have not known your HIV status. You give birth and you're told your child is HIV positive. That would be very sad. So, once you get exposure to HIV/AIDS, what happens? How do you progress from one stage to another? And is there a stage where intervention can be done? When you get exposed to the virus through the different ways that I have mentioned, it might take about 2 to 4 weeks, and then you develop what we refer to as a primary infection. The primary infection will present with normal signs and symptoms that you see with everyone. It could be a fever, just simple, something like a fever. It could be diarrhea, it could be vomiting. At times, you might find people having ulcerations around the mouth. You might find people having swellings around the neck, what we refer to as lymphadenopathy. That one develops 2 to 4 weeks after exposure, the primary infection. And then after that, what follows is the asymptomatic stage. In the asymptomatic stage, many people will have no signs and symptoms. Some will appear healthy, and the asymptomatic stage can take up to 9 years. So the sad thing is, during this asymptomatic stage, a lot of transmission is happening because you cannot be able to judge by simply looking at someone. And the asymptomatic stage, as I've said, can take up to 9 years. What happens in the asymptomatic stage is that the virus is replicating in the body, and so you have increased quantities of the virus in your blood, and at the same time, the cells which are supposed to protect you, what we call the CD4 cells. I know you guys probably have heard of CD4 count. The cells are being attacked, and so the count is going down. Your immune system is getting suppressed, and mostly by the end of 9 years, for other people it doesn't take up to 9 years, you end up with AIDS. And AIDS means at this stage, your CD4 count is very low, up to levels of less than 200 cells, and you have opportunistic infections coming in. These are infections which you get because your body cannot fight off. And when it reaches this level, any part of the body system can be affected. The disease can go to the head. And once it goes to the head, it can affect your nerves, it can cause a stroke, it can interfere with your cognitive ability as an individual. It can affect your meninges, which are just the coverings of the brain. Still in the head, the disease can give you a tumor in the head. And so HIV and AIDS is one of those diseases that exposes people to different types of cancers. It can go to your heart and cause what we refer to as dilated cardiomyopathy. It affects your heart muscle, so you find that a person cannot breathe well, cannot walk well. It can affect your lungs, the respiratory system. You get a very severe form of pneumonia, which is really not good. It can expose you to TB, which I already talked about earlier. TB can affect the lungs, can still affect the brain. It can go to your abdomen, to you, what you refer to as the gastrointestinal tract, affect you, you end up with diarrhea. It can go to many places in your body. It can affect your blood and give you anemia and make your platelet level to go down. What platelets do in your body is that they prevent you from excessive bleeding. So imagine when the platelet count is low. That is what HIV and AIDS can do to you. But the beautiful news is this: many people out there live with HIV AIDS for long, for very many years. A diagnosis of HIV and AIDS is not a death sentence. We thank God for the development and the intervention of drugs which we refer to as antiretroviral drugs. We refer to them with a general term as ARVs. This drug help your body. They help your body fight the virus. But still you must know that up to now, we don't have a cure for HIV and AIDS. So this is the advice I would love to give you. If you are a person who is sexually active, I have said you cannot judge from the face that someone has HIV and AIDS, especially if they're in the asymptomatic phase. If you are an sexually active adult person, please, faithfulness to one partner is key. It will help you a lot. If you're a man, be faithful to that woman. If you are a woman, be faithful to that man. And regularly, please have your HIV status checked. I have with me a HIV strip that you can find at the hospital. It is very quick. When you go to the hospital, VCT is free here in Kenya. Counseling will be done, and the testing for AIDS is a very quick procedure with this strip, what we refer to as the determinate strip. So with this strip, they'll just open it, take some little blood from your finger, then it will be placed. Then after a few minutes, you'll be asked to read the results yourself. So if you haven't had your status checked, please do so. HIV AIDS, when you take the drugs well, is a disease that should not be a scare to you. If you have any questions, please feel free to share with me. And if you would love to share a testimony of your fight and struggle with HIV AIDS to help other people out there that are going through stigmatization because of HIV AIDS, please inbox me on the number on the screen, 0728 348 403. And the last thing, as I finish, there is this one song that I want to encourage you with. It says that when you think that the Lord has already done too much, oh my, He continues doing it. So continue trusting in the Lord. And it's been sung by Sinner, just a chorus. When I thought that He had done too much, oh, Jesus did it again. I'm counting my blessings. I can't just keep it to myself. When I thought that He had done too much, oh, Jesus did it again. And God bless you. Thank you.